This is a Defocus Media production.
Audio Jungle.
What's up, everyone? It's your favorite optometrist, Dr. Daryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus.
Hey everybody, I'm Dr. Jennifer Lyerly with Defocus Media, and we are back with the new telehealth episode. And this is a new take on telemedicine that we're really excited to talk about, right, Daryl?
Yeah, this is like a completely 180. It's a spin on it that I've never actually seen before. So I'm very excited to learn about how this platform works, how it can make me a better optometrist, and be able to give to my patients better day in and day out.
Yeah. Well, I'm going to let Dr. McWherter tell us all the details, but just to kind of get you guys in the loop of what we're discussing, he has founded Telasight, and imagine if all of your best friends in optometry were the leading minds in their specialties, and you could call them up and ask them your tough clinical questions at any moment. So you were calling up the likes of a Dr. Paul Karpecki to ask a cornea question, for example. That is Telasight, and if that's getting you excited, let me introduce the founder, Dr. Ian McWherter.
Well, hey, thanks, guys. Thanks again for having me on. Dr. Glover, Dr. Lyerly, we really appreciate it. We're really excited to launch this new platform and tell you guys about it. You know, a real quick history of me is I'm from Pennsylvania. I went to school with Dr. Glover at PCO.
Represent, baby.
Yeah. After I graduated, I went down and did a residency at Benjamin Blue Eye Centers in Louisville, Kentucky, where I work full time now. It's a very OD friendly co-management center. You know, does secondary, tertiary care, and then I also worked down at the Kentucky College of Optometry as their head of optometry telemedicine too, and trying to implement telemedicine for the faculty and the students there. You know, which is increasingly important, especially during this new COVID time and everything like that.
Awesome. Well, I must admit, and I mean, no one judge me out there. Don't throw rocks at me, all right? But you are the first young OD that I've seen talk about telemedicine in this way, just in general. Because most of the folks we have on, Jen, they're more seasoned optometrists that we typically have on that's talking about telemedicine. Because you graduated in 2012, right?
Mm-hmm. Yep.
Yeah.
That's right.
That's pretty cool. I mean, we had some younger folks on the other day, I guess, with Samuels and Morgan. But then again, I tech for Morgan, so I can't say he's so young out there, right?
Well, you know, I was listening to your podcast the other day, Dr. Glover, and you had a telemedicine episode, and you were kind of talking about, you know, if you don't get out there and own it and make telemedicine what you want it to be, and control it and shape it, you know, somebody else is going to come in and shape it for us, and we definitely don't want that. And so, you know, I think you guys are great to kind of raise the issues, raise awareness, and make sure you do get people talking about it.
Yeah, you know, it's funny. I had to take a page out of Jen's book, and I did a poll on my personal Instagram just to see, you know, if anyone was interested in all-eye refractions, and it was 10% said yes, 90% said no. And I'm just sitting here thinking that, you know, like you said, if we don't control this, it's going to pass us. We can't be reactive. We have to be proactive. So we have to do something about this because patients want this technology. And I'm not going to be that dinosaur that's just sitting there thinking that everything is going to be okay. I love my profession, and I want to help propel my profession, and I want it to grow, especially for all the younger ODs behind me. So I just feel like we need to do better as eye care professionals to really accept what's going to take place in the future.
Yeah, no, for sure. Couldn't agree with you more. Especially, you know, we would love for this to come from within optometry and let optometry shape it. But, you know, a third-party disruptor comes in and who knows what'll happen. And you kind of saw some of that with you know, those online refractive and what formerly was our alternative and things like that. You know, luckily, you know, the FDA or the FDA stepped in and you know, kind of made sure that they were following all the requirements, and it turns out they weren't in some situations. So no, I definitely agree. But a lot of the telemedicine that's been out there now has been this, you know, doctor to patient interactions. That's where most telemedicine focuses on. And that's, you know, and it's definitely important for now, especially with COVID and routine eye exams kind of getting suspended. But our platform is all doctor to doctor interactions. We aim to help optometrists treat more medical eye disease. And that's kind of the whole goal of behind the platform.
Let's talk a little bit, because like you said, your platform is completely different. We're not talking about performing patient care. We're not talking about anything controversial, because this has been something that we've been doing as an optometrist for a very long time, calling up a friend or a colleague to ask for help. What do you think is so unique about what Telesight's doing versus, me calling up Daryl to ask a question, for example?
Right. No, great question. So,
let me give you a real life situation, because this happens maybe once a quarter, especially if it involves contacts. The last time I called Dr. Lyerly, ring, ring, ring. Jen, what are you doing? Chilling with the baby. What do you think?
Chilling is probably not the word I use, but yes.
Let's just say having a good time, right? But
right.
Fast forward to the point. I had a patient that came in, and their cornea wasn't in the best of shape, extremely nearsighted, irregular cornea. And I don't really like to deal with specialty lens. So I was calling Jen to ask her about a Synergize, a duet lens, and seeing if it was a good candidate or not. And, to call her, it took, maybe 2 minutes, Jen, and then you were off. And I was able to do exactly what she stated, and I was able to make that patient happy. So as Jen was touching on, what makes that different from what you guys have outside of the lineup?
That's a great question and a really important point here. So, just to give your audience and viewers a little background on Telasight. Telasight is a real-time practitioner telemedicine app. So our goal is to provide instant consultation. So while the patient is in your chair, you can get a real-time second opinion to help optometrists treat more medical eye disease, retain more patients, grow their practice, increase their medical revenue from increased billing. So on and so forth. There's a lot of pluses there for the doctor using the service. We can talk about later about the pluses for the patient. With less travel time to get a second opinion, less co-pays for potentially second office visit there. But to your question, what separates us from calling up your friend? Well, to be honest with you, if you're in a group practice and you can walk down the hall and get an instant second opinion, or you have that really close relationship with a friend where you feel comfortable calling them, maybe Telesight's not for you. But there's a lot of people that don't necessarily have that really cordial relationship where they feel comfortable calling and ask questions. They might not have that network established. If they're a new grad coming out of school, they might not have somebody to bounce those ideas or questions off of. If they're in rural, solo private practice, they might not have that network, or the specialist is so far away that they don't, keep that connection up because they don't see them quite as often. And the other thing is too, for you, you call up Dr. Lyerly, today and ask her a question about this chronic lens case. Well, tomorrow, let's say another patient comes in with RK or another irregular cornea. Are you going to feel comfortable calling her up again, ask her another question? You're going to feel like, oh, I'm bothering her, and maybe be hesitant to make that phone call. At Telasight, we don't want that. We want to eliminate that issue at all. That's why we offer unlimited consultations. You can call us as much as you want to. We want to be there for your second opinion, and that's what we kind of rely on. We're going to be there way, and we're going to provide you the most up-to-date evidence-based medicine and latest standards of care, and that's kind of what we stand behind. A lot of people get on, let's say, the internet, or they'll get on ODs on Facebook, or they text a friend or whatever, and sometimes they get tons of different answers when they post these things on social media, and I'm sure you guys see they're sometimes all over the place. And so we know we stand behind the information we have. As we did say, we have leading experts in this field that we know are going to provide you with top-notch information. You can count on us to be there. That's kind of where our value is. We're there. We stand behind it. You can call us as much as you want to. You don't ever feel like we're bothering you. Our consultants are really good. They make sure that create a really open, honest environment to ask questions, feel engaged. There's no dumb questions, not at all. We're happy to talk to users and doctors all the time. And that's actually where this idea came from. I mean, we work in a co-management center, a lot of us do, and we get calls and texts and questions all the time about, hey, what do you think of OCT? What do you think about this visual field? And we really enjoy that. That's one of the things we really enjoy about our job is we stop what we're doing, we look at the images, or call the doctor and discuss the case and go through differentials, or hey, what do we need to do? Things like that. And we really like that. And we realize that we're providing that service to our referral network, but our referral network is just in one small geographic area. And a lot of people outside the geographic area don't have that maybe access or relationship, or they don't feel comfortable. And we don't want that. We don't want the barrier to treating more medical eye disease to be, the hesitation to ask questions and learn. And that's what we want to do, to provide that service to other optometrists to help get the profession treating more medical eye disease.
Well, I have two questions for you. And number one, will this just be eye care related, OD, OMD, or is this going to branch off into other healthcare disciplinaries?
Man, Dr. Glover, great question. So we are just starting in the eye care market. I'm an optometrist. That's what I know. When you think about it, though, it is very applicable to other fields of medicine, nurse practitioners, dermatology, primary care doctors, anybody really. And unfortunately, there's no service like this really in any other field of medicine. So we would love to expand and grow, but we're focusing on optometry right now. So that's phase 4 down the line. We're at phase 1, just getting launched right now. Initially we're going to provide consultations Monday through Saturday from 7 a.m. to 7 p.m. Eastern Standard Time. So we cover pretty much all the East Coast, most of the West Coast, like I said, Monday through Saturday. And eventually we'll start going to 24-hour coverage, where we will then be able to offer this service to ER doctors. So a rural ER that sees a patient in the middle of the night and they don't necessarily have a staff eye doctor to talk to, as opposed to just getting them started on a erythromycin appointment. Now they can get that real-time consult and maybe triage those patients a little bit better, get into the appropriate eye doctor the next day, and hopefully improve quality of care.
Yeah, and that was kind of where I was going with that, because we get all these patients coming in with some type of conjunctivitis or abrasion or whatever, and the ER folks or just primary care physicians always give the same.
Yeah, exactly.
I think that'll be a great option to be able to communicate and educate them, and also gain confidence from them that, we are doctors, we have knowledge, right. We know what we're doing. So send all your patients that have eye care problems to us. You don't always have to send to a OMD. We are just as knowledgeable as well.
Oh, for sure.
The other aspect I think would be great is with endocrinologists. I mean, I think, with the amount of diabetic retinopathy that we're seeing, that'd be great to be able to contact them if we have a question about something, or, it's just so much that you could do with this. But moving on to the next question I had, the platform, let's talk about that a little bit more. Is this, I go to a website, or is this an app? Use my cell phone? Yeah. How does this work in general?
So you can do it from your cell phone, you can do it from your laptop, you can do it from your desktop, whatever you prefer. It works on Android, iOS, your web browser. You start a website, you go to telasight.com. That's where you log in, and then from there it transports you over to the telemedicine platform that, like I said, is app or web-based, whatever you like to use on your phone or desktop. So if you're in the room, you can pull your phone and call. If you're logging on a laptop and get a consultation that way, we do these in real time. So a lot of patients in the chair, we're going to be there for you. But let's say you're real busy in clinic and you don't have time necessarily to talk right now. You can always schedule a consultation and say, hey, I want to talk to somebody at 5 o'clock. I'll be have a break then, and I want to review this difficult case that I had, or what do you think about these OCTs or these visual fields, and should we get this patient started on some drops? Whatever you want to talk about. You could read a new journal article that you had some questions about that you wanted to talk about, and call in and ask about that. You asked about contact lenses. I'll be the first to admit, contact lenses are not my specialty. So you call me about contact lenses, I might not know the answer, but the nice thing about the Telasight platform is that if another consultant's online, I can loop them into the discussion, bring them in there, get another consultant who's maybe better suited to answer that question, and get those scleral contact lenses and irregular RGP fits question answer for you. And if I don't know it, I guarantee I'll go out and find the answer and get it back to you. And that's the ownership that the consultants take, make sure that we provide the doctors calling in the best level of care and customer service we can.
Man, that was like perfect timing. We had a question that basically just was asking that, and you just...
Oh, really?
That's kind of freaky, man. What are you doing over there, man?
It's all planned.
Oh, my. Well, thanks for answering that. I mean, that was...
Oh, yeah.
That was a great question. I mean, I also like what he asked. You know, if there was a like kind of like a round table of discussions. You know, in
Yeah,
regards to if someone's unable to ask a question. You know.
for sure. Yeah, definitely. Yeah, happy to bring in people into the call and bounce off other ideas. You know, nobody can know everything, but when you put a lot of good people together, usually you can come up with the right answer and get the best standard of care and evidence-based medicine out there.
Awesome.
Well, we've talked a lot about some of the advantages and the availability of this service and some of the expert opinion people, opinion leaders is the word I'm trying to use here, that are going to be available. So why don't we talk about the mentors that are serving on Telasight?
Yeah, we've been really, really lucky. We've got a lot of big names and experts in the field of optometry to kind of buy in and come onto this platform. I think they see the value in it of helping optometrists treat more medical eye disease. And a lot of these people are the ones that you're going to see on the lecture circuit. They're in every journal or magazine that you pick up. They're at every meeting. And they're very well known. And they're the ones that are up there educating optometry through lectures and articles to try to help them expand their knowledge, to grow their confidence, to practice to their fullest scope. And as the old adage goes, you have to educate before you legislate, right? And that's what they're out there doing. But sometimes there's this disconnect between what you're learning in the classroom or in the lecture hall to when you leave that lecture hall, implementing that into your clinic. And there's where Telasight fits into this is it's kind of that bridge. It helps you make their transition to a more medical model smoothly. And I think that's why we have so many consultants like Paul Karpecki, Greg Codwell, Cliff Cottle, Joe Salka, Lee Peplinski, Austin Lifford, Kyle Cheatham, all these great people have come on board because I think they see the value in creating that bridge and that gap to help optometrists kind of continue to move forward and practice to their full scope. Even if you're out there practicing medical optometry already, which is great, there's still going to be questions you have. And this maybe will allow you to practice more medical optometry. So it's not just the person who's dipping their toes into the water and just getting started. It's definitely for them too. But are you already practicing it? Can you practice more? Can you continue to expand there? I think that's why we have a lot of great people kind of coming on board there. And we're always looking to bring on more consultants too, to make sure we have a really deep bench of consultants and can cover pretty much all subspecialties of optometry as much as we can. We're focusing obviously on ocular disease right now, but we want to make sure we have binocular vision, low vision, contact lenses, all that covered.
That was going to be my next question. If you wouldn't mind sharing some of the specialties like neurorehabilitative optometry coverage or any of those that maybe aren't as common, but when you see those patients, many of us don't know what to do to help them.
Yeah, for sure. And some of those people are so specialized. Definitely want to make sure we have consultants with that, specific knowledge base that we can rely on them and lean on them and get that kind of expertise in those real-time second opinions or consultations or get back to them. There really is no better, at least, and obviously in my opinion, there really is no better learning experience than working through a real-life patient or real-life case. And outside of a residency, optometry doesn't really get that unless it's years of clinical experience, working with patients. And so this peer-to-peer mentoring service basically provides that to optometrists. It helps them bridge that gap. It helps them, gain that confidence level and make the transition to treating more medical disease, or if they want to start treating more vision therapy. And they want to rely on those consultants too. That's what we're here for. We're here to help answer any questions they have and be their second opinion. So as we talked about, a patient comes in, and if you're in a rural practice, that specialist might be an hour, sometimes 2 hours away. If you can get a real-time second opinion while that patient's in your office, you're saving that patient a ton of travel time, a second copay where they might have to, obviously have a financial burden perhaps. And for you, as the optometrist calling in, it's a win for you too. You're growing your practice, you're increasing your patient base, stronger doctor-patient relationships, increased confidence, and you get to bill for the additional medical eye exam you're providing. There's actually even, Medicare even sees the value in these consultation services where there's even a separate CPT code that an optometrist calling into Telasight can bill for the time they spend consulting with us. And so, you know, if an optometrist can see about one extra patient a month using our service, it's basically paid for itself. And then any additional follow-up there is just increased profit and revenue for the doctor.
Now, you mentioned time and seeing extra patients. I'm just thinking here, with this platform that you guys are creating,
Yeah.
is each eye care professional allotted a certain amount of time that they can actually communicate with the other person they're trying to get the opinion from or information from? So like,
No.
for you, is it only like a 5-minute, this is 5 minutes, this is it, and move on? Or do I get the whole world and then some for the most part?
Whatever you need, Dr. Glover, we're here to help. If you need, we make sure we answer all the questions that you have. You know, obviously we try to do it in efficient and effective communication because we know you have other patients in your clinic that need to be seen. You may not have all day to sit and talk to us. So, but if you do have more than one question, call in. We're happy to talk to you as long as it takes.
Awesome. Well, the $1 million question, which everyone is wondering, is costs.
Yeah. Question. So we needed to price it where it's not outrageous, where it's not prohibiting optometry from utilizing the service and practicing more medical eye disease. We initially thought, hey, should we sell, buy 5 consults for a certain amount of money? And I was actually really against that because it kind of curbs the utilization of the service. We don't want that because you're going to see a patient and say, is this worth using one of those consultations? And we don't want that to be a question or to ever be an issue. That's why it's unlimited consultations. The service costs $89 a month. It's a monthly subscription fee. You can call us as much as you want to. Using the code which you mentioned earlier, Dr. Glover, DFocus10, will get you 10% off the monthly subscription fee forever. If you sign up by June 15th, just as as an onboarding or early adopter, that's just something we're offering to everybody right now. Or if you want a month free, there's another promo code out there, Telasight 2020. That's on the website. You can get a month free if you want to kind of test drive the service before you sign up for it. That's okay too. But the value proposition really, and what we think this helps the optometrist do by treating more medical eye disease, if they can, like I said, use about 1 extra patient a month, they're going to pay for the service themselves, and just continue to grow their practice and get how many additional referrals by knowing that they're the doctor in the community that can handle these maybe more medical patients as opposed to having to go far away for a specialist.
Well, it looks like we have a question from LinkedIn. Sally Stein, do you have any experience with patients with intellectual disabilities?
We definitely do see those patients in the clinic. They're obviously more challenging for sure whenever you're examining them. The sometimes subjective responses from that patient are very limited, and you're really going on your objective exam about how is the function of the eye look and things like that. There are some other objective measures that we don't personally have in our office, but you can do, VEPs and ERGs if you really needed to test the functionality if you were able to get that exam. But our consultants can definitely help you with those types of exams if you do have questions or issues about, how to examine this patient. What's a good test to try to check some of this stuff, or any clinical tips or pearls, that some of these seasoned clinicians have and are happy to share.
That's great. I've been seeing, especially with our new protocols in the office in place, many of the posts that I'm seeing on our OD forums have been people really struggling to examine, say, autistic children, or whenever you have someone who needs special attention and your special care, and you put them into a more challenging environment where now they're behind a bunch of shields and masks, it can be a recipe for disaster. So knowing that you have consultants that can talk you through how to perform a more difficult eye exam is a really useful utilization of this tool.
Oh, definitely. Yeah, for sure. And, sometimes it comes down to, what the doctor is projecting in the exam room. If you go in there and you're nervous and everything like that, and you're not confident in your skills, then the patient instantly picks up on that. And one of my mentors, Dr. Donald Bennett, said, never let him see you sweat. And so it doesn't matter how nervous you are. As soon as you walk in that door, you got to put your game face on, and for sure. But definitely, those can always be challenging exams.
Well, if there's one point that you wanted everyone to take away from this interview this evening, what would it be, Ian?
Try it out. We would love to have you sign up. You get a month free. Welcome to come on board. You go to telasight.com. You can sign up. Sign up now. We don't launch until July 1st. So on July 1st, jump on, use us, get your questions answered, see how it works in your clinical practice. You see a patient that comes in with an unfamiliar condition. Instead of referring it out or trying to look something up in an outdated textbook or Googling it, call Telasight. We're your second opinion, and we're happy to help and try to increase the amount of medical eye disease that you're treating, because everybody knows, as you said, we have to expand to that more medical model. A lot of glasses and contact lens sales are moving online. With this whole COVID situation, a lot of people are losing their vision benefits, and due to high unemployment rates, and so by having a more diverse practice and transitioning to that more medical model, you can make up for some of that lost revenue and kind of grow your practice. And it's just it needs to happen anyway. I mean, it's just the amount of eye care that is going to be needed in the U.S. Ophthalmologists can't handle it, and optometry is very well positioned to take on that ownership and treat the additional disease. And Telasight can help make that transition smoother.
It's a beautiful mission to try to help us manage more of the patients who are in our chairs and be more trusting of what our knowledge base and our education as optometrists have given us. So,
yeah, I mean, well, thanks. And, sometimes that's it. I mean, everybody's taught to, a very high level in school and CE and lectures. And sometimes you just need that little, push or confidence booster, or, hey, I got this question. What was that? Or it just tip of your tongue. And that's where we step in and we just help you, kind of like a little safety net to get you going in the right direction and help grow your practice. If that patient's in your chair, treat them. And if we can't get you to, if we can't, if it's outside your scope, or, this is something that needs to go see a surgeon, then we want to make sure you get them started on the most appropriate treatment right away, as soon as possible. Try to help improve their care, get them to specialists as soon as we need to. But if we can keep them in-house and keep them in your practice, that's what we prefer.
Yeah, I love this concept. I remember when I first got out of optometry school, and Jen, I was actually, I can't remember which office I was in, but I remember that Dr. Jason Price and Dr. Jeff Strand always said, if you have any questions, instant message me. So I would instant message them real time with real patients and ask them questions of stuff that I had no idea about. And I love what you guys are doing, because it's essentially the same. It's like you're making this kind of like a intraweb or intracircle where, you're referring to your own profession and they're able to give you an answer right away, instead of, like you said, sending them out to, outside of the clinic, whether it's OD or OMD. You're getting that answer right then, right there, and you're able to make that patient happy and not keep them waiting. Because a lot of times patients, they're anxious. They don't want to wait for an answer for something that you're trying to get to the bottom of. So, that's going to save a lot of stress and anxiety for our patients as well.
Exactly. Yeah. Great point.
Phenomenal.
Thank you so much for your time today. And I wanted to give a shout out because I did see Dr. Goller's comment, and I saw in 2020 Glance your feature this week too. So Ian, you're doing a great job getting the word out about this platform, and hopefully more and more people will find out about this and the great spirit behind the mission.
Well, hey, I thank you guys so much for having us, or for having me on. We really appreciate helping you, I really appreciate you helping us get the word out and tell everybody about Telasight. Please come check out the platform. It's www.telasight.com. You can use the promo code, as Dr. Glover said, DFocus10 to get 10% off if you sign up by the 15th. And we're looking forward to working with you. We're looking forward to having you on board. And if you do have any questions at all, please ask us. That's what we're here for. That's what we want to help answer and promote and help you treat more medical eye disease.
Awesome. Well, thanks again, you guys. Your favorite optometrist, Dr. Daryl Glover, and your favorite opto nerd, Dr. Jennifer Lyerly. And this is my brother from PCO representing. I'm glad to see you doing some amazing things out there. You are always a rock star in school and you're just continuing on, man. You're making us PCO representatives proud, man. So keep up the great work. And I look to see, I can't wait to see Telasight grow, man. I know this is going to be an amazing thing for the industry.
Well, thank you. Really, really appreciate it. Hope you guys have a great night. Stay safe.
All right. Thank you. Have a great one. See you guys. All right, colleagues, and it's a wrap. Thank you dearly for hanging out with the Defocus Media team. We hope truly something resonated with you. And if it did, be sure to give us 5 stars. And make sure you follow us on all social media platforms. Facebook, Instagram, Twitter, LinkedIn, you named it. And our handle is at Defocus Media on all platforms. And until next time, be sure to keep it 2020. And we look forward to seeing you on the next episode.